Demystifying insurance coverage for mental health therapy. Does my insurance cover mental health therapy? The general answer is usually yes. Insurance covers mental health illness, but does not cover self-improvement. Mental health is making great strides in the insurance market, and an increasing number of providers, the medical community, and society as a whole are understanding the connection between mental health and physical health and how it affects work productivity, medical necessity, and positive self-worth. With that said, mental health insurance authorizations and coverages are vast indeed. Some plans have copays, some have deductibles, others have carve-outs, and have assigned mental health care to third-party payers. Attend Therapy needs to get credentialed with each insurance provider to become part of their network. Currently, we are credentialed with several insurance companies and are continually working on becoming credentialed with more. Please check our website attendmentalhealth.com to see which insurance companies we are currently credentialed with. It's a process and is not instantaneous, so if you don't see your insurance company on our website, please keep checking back, as we will add insurance companies as we become credentialed. For the insurance companies we have received the credentialing, we will work with you and your insurance company for authorization for mental health therapy. A point to note is that if we are planning to utilize mental health services under insurance, a person must meet medical necessity. Imagine it like this. If a person were to go to the doctor and have a disease, the doctor would diagnose the disease and treat it. The insurance company would pay and everything works out well. Now imagine, a person goes to the doctor and says, "I want to be the healthiest person ever, and I want to check in every week to make sure I am on track." The doctor does not have a diagnosis and does not have anything to treat. The doctor is able to give pointers, education, mark progress on things like weight, BMI, and diet on how to stay healthy. However, the insurance company will not cover this because they only insure if the person feels sick or has a diagnosis. They may cover one physical a year, but they surely won't cover weekly physicals. It's often true with therapy. A person may come in and think they want to utilize self-improvement services, but they don't have a diagnosable mental health illness, and so the therapist is unable to bill insurance. We can still offer education, pointers, tools, and techniques, but we won't be able to bill insurance. In these cases, we will bill privately as a cash pay client. This often is mental wellness or self-improvement rather than mental health illness and should not be confused with the other. How do I know if I meet medical necessity? In general, there are 3 things that determine if a person meets medical necessity. 1 is a verifiable diagnosis. At Attend Therapy, we utilize tests and the DSM-5, Diagnostic and Statistical Manual of Mental Disorders. These tests and guidebook are things that rate the level of anxiety, depression, mood disorders, or level of stress, such as in post-traumatic stress disorder. We administer these tests and review symptoms at the first session so that we can determine a diagnosis at the start of therapy. Second, we discuss impairments. We talk about how this diagnosis is affecting your life. It might be that depression is causing you to not be able to get up and go to work. Or someone that is anxious might have a hard time driving a car, or someone with trauma might be having flashbacks and anger issues that are causing harm in relationships. These are called impairments in life functioning. Lastly, we have to come up with a treatment plan together with you to treat the mental illness. We utilize treatments and goals such as psychoeducation, a decrease in symptom reduction, reviewing progress in therapy, and various evidence-based psychotherapy treatments. If all of these 3 things are met, then we have met medical necessity, and the therapist is able to bill your insurance. If these things are not met, then we would need to bill privately for your care. Have more questions? Talk to a counselor at your first session, and they will be able to tell you whether you meet medical necessity or whether we need to utilize self-improvement services. Please contact us for more information. You can visit our website at attendmentalhealth.com or call us at 408-740-3692. Finally, you can email us at administrator@attendmentalhealth.com. If you found this video helpful, don't forget to like, share, subscribe, and hit that notification bell for more insightful content. Thanks for watching, and we will see you in the next video.